So here's an eosinophil. Let's start with that. Eosinophils are one of the granulocytes. Okay, the granulocytes include eosinophils, neutrophils, and basophils. Those are the granulocytes. Okay. So if you ever hear the term granulocytic leukemia, it means you have too many eosinophils, basophils, or neutrophils. Granulocytic, because these are the granulocytes. They call them granulocytes because the early microscopists looked at these cells and they said there's little tiny granules in them. Well, those granules are really vesicles containing mediators of inflammation or mediators for the function of the immune system. So those are vesicles that have the potential of being released. So that's why we call them granulocytic, because eosinophils, neutrophils, and basophils have them. Now the granulocytes are different in each of these three cells. In eosinophils, the granulocytes are kind of reddish or orangish in color. Neutrophils, they're so tiny you usually can't see them. Okay, and then there's the basophils, at least with light microscopy. Then the basophils, the contents of the granules make it look kind of purplish. Or what color is that? Purple? Okay, because I may be a little bit colorblind. So anyway, so here's what a basophil looks like, a real one. Here's what an eosinophil looks like, it's a real one. And here's a couple neutrophils. Okay, for neutrophils have several names. The correct name is polymorphonuclear leukocyte. Polymorphonuclear leukocyte. So they shorten that up with just initials and they call them PMNs. Poly, P, M, morphonuclear leukocyte. PMNs, nuclear is at the end. Okay. But it's all leukocytes are white blood cells. Okay. They also call them, well, they call them polys, they call them neutrophils, and they call them PMNs in the hospital. That's about where you're at. Okay. Where you're at will determine the culture of that institution. The culture of that institution will determine which one of those names you're going to be using. So you really have to know them all. Okay. Again, several names for the same thing. Okay, so here is a lymphocyte. Okay, here's a lymphocyte over here. Okay, this one right here says it's a large lymphocyte. If you see a large lymphocyte like this, in all likelihood, it's a natural killer cell. Okay, natural killer. As the name implies, it's a killer. Okay, that's what it does. Okay. And we'll talk about the physiology of natural killer cells when we get into immunology. In fact, most of the details of all these cells are going to be talked about in immunology, not here. Okay, but you have to recognize these cells. Because some of you may have to recognize these cells, in real life in your career. So you're going to, and it's not hard, it's easy. All you got to do is just get used to the morphology of these cells. So there's a bunch of red blood cells in there too, okay? And you might say, see all these little holes? They're really not holes, okay? The red blood cell is a biconcave disc, and the middle was where the nucleus used to be, and the rest of the cell is where the hemoglobin is. Okay, so it puffs up, it looks like kind of like an inner tube of a tire, but it doesn't have a hole in the middle. If it clears out a lot, and some of these are not, that's an indication of anemia. Okay, these holes. And you're going to, a lot of us are anemic. We don't even know it. Okay, so that's just an indication, doesn't necessarily mean that the person isn't. Because what it could mean, too, is when the person made the slide, they let it dry a little bit before they put a cover slip. Or the drying process of the slide caused that. So that's a possibility, too. In other words, it could be enough. Okay, so lymphocytes, they have a really big nucleus compared to the amount of cytoplasm. And sometimes you can't even see the cytoplasm at all. So this one right here is a lymphocyte too. In fact, natural killer cells are lymphocytes. Okay? And we'll be talking about the two other lymphocytes a little later. And then we have these little things in there. Those are platelets. Okay? That's a platelet. And then we have a monocyte. Okay? Monocytes, they're bigger than the rest of the cells. And they have sometimes their nucleus is it has lobules or two, or like this type of morphology or this type of morphology. And it has a lot of cytoplasm compared to lymphocytes. So those are the cell types. Okay? So, since we've done that, let's pull up this right here. Okay, these are pictures I took a long time ago. Okay? So, keep referring to the images in the lecture handout. Those images we just gone over together. And keep in mind that when you're looking at these images, this one right here in particular, it is extremely rare that you're going to see all the cell types in one image like that. Whoever found that slide was probably looking at not hundreds, probably thousands of blood cells. Okay? To find that one, or even that person was really, really lucky. Okay? So last night I was taking pictures, because I'm going to show you those new pictures today, of blood, and I couldn't find one basal. All I found were eosinophils. And that's because basophils are so few in number, okay, in blood plasma. So let's take a look at the slides I took a long time ago. So, based upon the pictures we've just looked at, what cell type is that? No. A lymphocyte. Who said that? Okay. A lymphocyte. What cell is that? Probably a come on, you gotta know. Just look at your pictures and make comparisons. It's probably a monocyte. Okay? Probably. See what it says. 2 lymphocytes. So I was wrong on this one. That's probably a large lymphocyte. Now you can see how even an expert can mess it up. Okay? Can be wrong. Now, I would argue with that. I think that might still be, if anything, this right here is a monocyte that got boogered up in the smear when they spread it. This one's a lymphocyte, most definitely. You can barely see the edge of the cytoplasm, so it's definitely a lymphocyte. This could be a large lymphocyte. If it is, it's probably a natural killer cell. Okay. Now, when you're looking at these cells and you're counting them, that's part of your CBC, complete blood cell count. Okay, you do that to give you information as to what's going on in the individual, because these cell types, these white blood cells, respond to different types of infective activity. They're responsible for different aspects of the pathology that may be going on. So if you can figure out, okay, what cell type is the most numerous, then you end up with what we call a differential diagnosis. A clue as to what's wrong with the patient. Okay? That's why you do a CBC. Okay, so what cell type is that? I think it is basal. I think it is. Okay. So, what cell type is this? Looks like a lymphocyte. What cell type is this? Probably a monocyte. What cell type is this? Notice the red cytoplasm. It's probably an eosinophil. Anytime there's red, it's eosinophil. That's why I said on this image over here, I think it's a basophil, but I'm not sure. Because I see more dark than I see red, so I'm leaning towards basophil. But the argument could be made that's a eosinophil. Now, keep in mind, when you're doing your CBCs, you're counting your cells, you will make mistakes. But the deal is you're going to be right more often than you're wrong. So it's really okay to have a little bit of error in your count. Because if any one of these cells have a higher percentage, that's still going to show and can lead you to your diagnosis, even if you make mistakes. Like I said, you'll make fewer mistakes than you will otherwise. So eosinophil, basophil, and monocyte. And I don't know what that is. It's a booger of cell. I would guess, I don't know. It's just wrong. So this is a really good example. So we got, what cell type is this? Neutrophil. Speak up. You can make mistakes here. So what cell type is this? Probably another neutrophil. So what cell type is that?
Monocyte.
Monocyte. Okay. Compare it to the size of the red blood cells. If it's really, really big compared to the red blood cells, it's a monocyte. If it's a little bit bigger than the red blood cells, it's probably a lymphocyte. And this has some little red dots in it. Therefore, it is it's got to be an eosinophil. Can't be anything else. This is a good slide. So, what's this? What's this? Eosinophil. See? It's not hard. Okay. What cell type is that? Eosinophil? Neutrophil. What cell is that? I would guess a lymphocyte. Okay? And I guess it's a lymphocyte because you see a little bit of cytoplasm and the nucleus is not lobulated. It's kind of old. So that leans more towards a lymphocyte than a monocyte. Okay. And because it's so large compared to the red blood cells, it could be a natural killer cell. So what is that? And what is that? And what is that? What do we have here? Okay. And the top two are what? I would guess that, yeah. Two basophils and a neutrophil? I don't know about that. No, I'm leaning towards more basal. What you think about it. Because we really don't see any cytoplasm. Okay? Okay, so what is that? See, you can make mistakes. That's a monocyte. What's the other one? A lymphocyte. And you can see some platelets in it, right? Okay, now the cytoplasm over here is kind of clear. Okay, so what's that? What? Monocyte. Okay, that's probably a neutrophil. Okay. What's that? You got some clear cytoplasm on both sides. Monocyte. Okay. And I don't know what the heck that is. Kind of boogered up. Okay, this is definitely a neutrophil, so let's move on. It's a neutrophil and monocyte. Well, I don't know. Okay. But I would go with the monocyte. This one should be easy. Neutrophil and eosinophil and a neutrophil, right? Right. Okay, what do we have here? Three neutrophils. Five. Okay, what do we got there? Huh? Monocyte. Yeah. What's there?
Like what?
It's probably just artifact. They're drying up. Okay. Probably just artifact. Two white blood cells. What are they? The nucleus is kind of oval around. It's not lobulated. There's a slight indentation. That's okay. Probably a lymphocyte. Both. One of them looks like it might be becoming activated. Or if it's not becoming activated, that's the way it normally looks. It's definitely a natural killer cell, which still says it's a lymphocyte. Two neutrophils. Okay. Okay, now these are the sample pictures I took last night, so bear with me. So, small cytoplasm. Huh? Lymphocyte. This one might be an activating lymphocyte or a natural killer. I would go with, it's too dark for that, maybe. Basophil. This one's more red. So we got a eosinophil and a, right? So what do we call this one again? Lymphocyte, you're getting it. Last time we went with basophil on that one, okay? And this one would be lymphocyte, monocyte, potentially a, I don't see any cytoplasm.
Oh, no, I thought you were talking
about basophil. Okay, so this one's kind of boogered up, but it is a monocyte. This one is really, really big, kind of lobulated. Monocyte. Another monocyte. I would bounce between neutrophil or basophil and eosinophil. So what's your call? Anybody? Okay. So this one right here, small amount of nuclear material. Lymphocyte, this one is neutrophil. Basophil, I guess. Neutrophil. What's this one? Okay. Is it? Okay, I'd go with it because it's lobulated, so, and then this one would be a lymphocyte, neutrophil, and a, okay. This is really big, but the cytoplasm is clear, so I would lean towards a monocyte on that one, and maybe a basophil here. Two neutrophils, but then I'd second my guessing myself because there's some red in the side. Okay. And if I start seeing a lot of these, I would count those as eosinophils, otherwise I'd count them. So this is different magnification, smaller. Two neutrophils and a potential basophil. Neutrophil, neutrophil, two neutrophils, neutrophil, possibly a basophil. Eosinophil, right? You all agree? Okay, so I think we got it. Two neutrophils, two more neutrophils. Lymphocyte, you all agree? Neutrophil, lymphocyte. This looks like it's bigger. Monocyte. So here's a good example of comparison between a monocyte and a lymphocyte. Okay, in terms of their size. Okay. Has some red down here, so I would lean towards eosinophil, but I wouldn't punish myself by calling it a basophil either. So this is, now look at the size again. So because this is lower mag, so this is a monocyte, and that could be a basophil. Could be a, and this could be a neutrophil. This one is really, really dark. There's some red in there. As a result, I think towards either eosinophil or basophil. Yeah, this one's pretty big in comparison. Monocyte, okay. Eosinophil lymphocyte, neutrophil lymphocyte, right. I don't know what I just said. Okay, so this looks like a neutrophil. Neutrophil, possibly more likely a neutrophil. Not sure what that is, I guess. What basophil, monocytes, basophil, and that. Okay, so that was kind of fun, right? Okay, now when we go into the lab today, we're going to be looking at these slides, right? The real slides. And you're going to find it's really, really hard to find eosinophils and basophils. It's more difficult to find a basophil than an eosinophil because there's few and far between. Okay? Not very many basophils. Okay? So, yeah, so use this image to help you determine the slides. Like I said earlier, tomorrow will be so just for fun, okay, and this is just fun, I'm not going to hold you to any of this. And I got these slides off the web page someplace, and I'm not going to hold you to recognizing any of this. Okay, but I do have some pathology slides in my slide box, and I encourage you to look at those as well. So this is just straight pathology. So chronic myelogenous leukemia. So we see way too many, well, neutrophils. Okay, that's what we're looking at. This is hairy cell leukemia. Okay. Owl eyes, Hodgkin's disease. Hodgkin's disease is a form of leukemia. And the manifestation is this owl eye type of morphology when you're looking at smears. And I don't know why. Hodgkin's disease is one of the leukemias that you can cure, provided you catch it on time. Okay? So these look normal, don't they? Yeah. Eosinophil, a neutrophil and a monocyte, just like it. So what's that? Slightly larger than a lymphocyte. This is definitely a monocyte. Okay. So this is an eosinophil, and this would be a lymphocyte. I guess these are normal too. Here's what a basophil is. Neutrophil and a monocyte. Now what do we have here? Too many neutrophils. Right. So this looks like myelogenous leukemia again, or something like. And that's one of the things when you're looking at the pathology. If you're seeing too many white blood cells, one or two possibilities. It's either a leukemia or it's an active infective process. So if you see a lot of neutrophils, that means it could be a leukemia or it could be just a full-blown infection, because neutrophils really respond to infections. Okay? And there's something else wrong with this slide too. The red blood cells, the holes in them are really big. Okay? They're really not holes. It's just where the membrane's stuck together, so this is probably iron deficient and something like that. Okay? You have 3 neutrophils, a monocyte, and maybe 2 monocytes. Another monocyte. This one is really weird. You're not supposed to see neutrophils that look like that. Okay, and I don't know why. Could be a result of folate or vitamin B12 deficiency. Folate is a vitamin B. B12, as the name implies, is a vitamin B. Okay, and you need B12 and folate for normal red blood cell production as it appears of white blood cells. These cells just look really weird. I would guess they're all monocytes, and there's too many of them. Okay, but that's what I would guess looking at this. But they're not. They're atypical lymphocytes. Okay, and I don't know what this is. Okay. Other than it does say here, this could be a result of Epstein-Barr virus infection. Epstein-Barr virus causes mononucleosis. Sickle cell anemia, no matter how you look at it. Too many of these white blood cells. So this is a leukemia. Probably lymphocytic leukemia because these all look like lymphocytes. More lymphocytic leukemia. That would be my guess. This says myelogenous leukemia. So, when it comes to the pathology, I'm not an granulocytic granulocytes, lots of neutrophils. This is a granulocyte too. This looks like an eosinophil. So too many granulocytes, granulocytic leukemia. A normal lymph node will be dealing with this one, getting immunology. Okay. And there's that picture we saw on the lecture presentation today. Same picture. Eosinophil, that's really a nice look at eosinophil-based cells. Monocyte and a lymphocyte. Okay.